Color blindness and weakness test. Color blindness is a congenital color vision disorder. There are many types of color vision disorders, the most common of which is red-green color blindness. According to the trichromatic theory, any color in the visible spectrum can be composed of red, green and blue. People who can recognize the three primary colors are normal people, and those who cannot recognize all three primary colors are called total color blindness. People who have reduced ability to recognize any color are called color weak, mainly red weak and green weak, and blue-yellow weak. If one primary color cannot be recognized, it is called dichromatism, mainly red blindness and green blindness. The red-green color blind population accounts for about 8% of the global male population and about 0.5% of the female population. Among them, about 6% of the population has trichromatic vision, color weakness, about 2% of the population has dichromatic vision, color blindness, and very few have monochromatic vision, total color blindness. In fact, almost one person out of a dozen people around you is color weak. Whether you believe it or not, this is true, but color weak is not color blindness. He looks no different from ordinary people. Even if you are color weak, you don't need to care too much. Color blindness and color weakness test. If you are unfortunately tested as color blind or color weak, I hope you will not be sad. It is determined by genetics. The following can further determine what kind of color weakness you have. Color blindness check chart. You can check the type of color blindness: red blindness, green blindness, red-green blindness, red weakness, green weakness. Classification of color blindness. Total color blindness. Cannot distinguish any color. The colors seen in the eyes are only black, white and gray. Different colors are shown in the eyes as light and dark. Red blindness. Commonly known as the first color blindness. Patients cannot accurately distinguish red and dark green, blue and purple, red and purple. They will regard green as yellow, purple as blue, and green and blue as white. Green blindness. The second color blindness. Patients cannot distinguish light green and dark red, purple and cyan blue, purple, red and gray, and will regard green as gray or dark black. In medicine, red blindness and green blindness are often collectively referred to as red-green blindness. The color blindness we usually talk about generally refers to red-green blindness. Blue-yellow color blindness. The third color blindness. Patients show confusion between blue and yellow, but can clearly distinguish red and green. This type of color blindness is relatively rare. Achromatopsia. Also known as red-green blue-yellow color deficiency. This type of patient has a lower degree of color vision impairment than achromatopsia, with completely normal vision and no other complications of achromatopsia. Specifically, they can distinguish objects normally when they are dark and bright. If the color is light and unsaturated, it is difficult to distinguish. This type of patient is rare. Partial color deficiency. Divided into red deficiency, first color deficiency, green deficiency, second color deficiency, and blue-yellow deficiency, third color deficiency, among which red-green deficiency is the most common. Specifically, the patient has poor sensitivity to red and green. When the lighting conditions are poor, the patient's color discrimination ability is close to red-green color blindness, but when the material color is deep, bright and the lighting conditions are good, its color discrimination ability is close to normal.